In this video, I will present about different methods for heart rate calculation in EKG. There are a couple of methods to determine heart rate in EKG. Before calculating heart rate, paper output speed should be checked. Standard output is 25 mm per second. On standard speed, 1 small square or 1 mm equals 40 milliseconds. One large square contains 5 small squares, representing 200 milliseconds. And 5 large squares equal 1000 milliseconds or 1 second. The rhythm strip contains 50 large squares or 10 seconds. Heart rate is expressed in number of beats per 1 minute. In EKG, 1 minute means 300 large squares, or 1500 small squares. These numbers are used to figure out heart rate. Let's explore different methods to calculate heart rate. There is no specific best method, and preference varies between clinicians. However, certain methods may be better suited for rhythms such as bradyarrhythmias or tachyarrhythmias. The first one is called large square method. In this method, count the number of large squares between two successive R waves. Heart rate can be calculated by dividing 300 by number of large squares. Remember, there are 300 large squares in 1 minute at standard paper speed. For example, if there are 3 large squares between two successive R waves, heart rate is 100 beats per minute. 4 large squares implies 75 beats per minute, and 6 large squares implies 50 beats per minute. Large square method is useful for sinus rhythm at regular rate. For very fast rhythms, small squares methods can be used. This method is similar to the large square method, except 1500s is divided by the number of small squares between successive R waves. For example, 10 small squares between R to R interval implies a rate of 150 beats per minute. The next method is called R-wave method. Count the number of R waves in rhythm strips for 10 seconds and multiply by 6 to calculate heart rate. The number of QRS complexes on the rhythm strip gives the average rate over a 10-second period. This is multiplied by 6 to give the average beats per minute. In this EKG, there are 7 QRS complexes in the rhythm strip, and heart rate is 42 beats per minute. Alternatively, count the number of R waves for 6 seconds and multiply by 10 to calculate heart rate. R-wave method is useful for slow or irregular rhythms. The machine reading can also be used and is usually correct. However, it may occasionally be inaccurate in the presence of abnormal QRS complex and abnormal T-wave morphology. For example, machine may count peaked T waves as QRS complexes, or miss QRS complexes with reduced amplitude. Normal heart rate for an adult is 50 to 100 beats per minute. Tachycardia means heart rate over 100 beats per minute. In bradycardia, heart rate is less than 50 beats per minute. In some situations, faster paper speed 50 mm per second is used. Doubling the standard rate will cause the EKG to appear drawn out or wider complex than standard 25 mm per second paper speed. The rhythm strip will thus comprise 5 seconds total capture compared to the standard 10 seconds. Doubling the standard rate can reveal subtle EKG findings hidden at the slower rates, particularly atrial flutter waves in 2:1 AV block. In sinus rhythm, each P wave is followed by a QRS complex. Therefore, atrial rate and ventricular rate are the same. However, in some cases, for example, in complete heart block, atrial and ventricular rate are different. Calculate atrial and ventricular rates separately if they are different. Atrial rate can be calculated as same exact way as a ventricular rate, except you look at P waves instead of R. I hope you enjoy this video. Thank you for watching this video. Stay safe and healthy.